Brett Klein with Eisenhower Health, and we're excited to have one of our newest physicians here with us today, and we'll get an introduction from Scott Strex, our Chief Administrative Officer, momentarily. But just a couple of housekeeping issues or thoughts here. Just realize that we are recording this and that we will be editing it and then posting it online, both on our YouTube channel as well as our Eisenhower Health website under cardiovascular videos within the next probably 7 to 10 days, if not sooner. We would ask everybody to please use the chat feature as we go along to ask any questions during the presentation. And then what we will do is we'll open it up at the end for live Q&A as well. And I will be the voice to be able to ask the doctor some of the questions as we go, but that allows us to record efficiently and move it forward. So since we're a little behind, I will get this off to Scott Strex. And Scott, if you'll introduce yourself and introduce the doctor, we'll get moving.
Hello, my name is Scott Strex. I'm the Chief Administrative Officer of our Cardiovascular Institute at Eisenhower. I'm very excited to introduce Dr. Bahiru, who recently joined us after an amazing educational journey. She did her undergraduate studies in neurosciences at the University of Southern California. She then went on to Stanford University School of Medicine and completed an internal medicine residency program at Northwestern. From there, she was a fellow at the University of Washington in advanced cardiac imaging. She also completed her cardiology fellowship at UCLA. We are very happy to have her join us and even happier to have her do this discussion today for you all.
Hi, everybody. Can you hear me okay?
Yes, you're good to go.
Thanks, Scott, for that introduction. My name is Ehete Bahiru, and I'll be presenting on heart-healthy diet. It is a topic that is very integral to what we do in within the field of cardiovascular medicine, cardiology, and some of this information may be very basic, and you may already know a lot of this information, but I think it's very important to at least understand what's recommended within our field, especially by one of the major organizations, such as the American Heart Association. Okay, good. All right, so we'll start by reviewing what the typical American diet looks like. So the standard American diet, or it's known as SAD, is typically it includes about 2,100 calories a day, and as you can see by the display or the picture in the image, includes very high processed foods. About 58% comes from processed products. 16% of the total daily calorie comes from protein, 47 carbohydrate, and about 36% from fats, and 22% of all calories come from added sugars. And we'll we'll go into each and every major food category and how to distinguish between healthy and not so healthy choices for your heart. Okay, so what is considered a heart healthy diet? This is a multi-billion-dollar industry, the diet and lifestyle. But it's, if you go back to the basics, you can actually follow a very healthy lifestyle, heart healthy lifestyle, enjoying good food without having to invest in so much of what's out there. And there's a lot that's out there. Obviously, I'm sure a lot of you have heard about, the Mediterranean diet. There's the keto, there's the paleo, vegan, vegetarian, just to name a few. And what does the American Heart Association recommend? So a lot of the material that I sourced for this lecture comes from the American Heart Association, because there's, obviously a lot that's out there, but what's actually recommended as being heart healthy is important to know. So going into some of the major food categories, starting with the carbohydrates, as it comprises a majority of, at least takes up the greater share of the percentage of total calorie that we take in as a typical American. And so two major categories, so simple carbs and complex carbs. So simple carbs, the biggest difference between the two is the simple ones are digested quickly. They give you a burst of energy, gives you fast glucose in your blood streams, and there are two kinds. There's the added sugar, and then there's the natural. And the added sugars, as you can see, we typically call them empty calories. They lack vitamins and the important minerals that you need, but they just give you a burst of energy, sort of like the sugar high. And then the natural ones that you get from fruits and milk also are simple carbs. They can be available immediately within your bloodstream and give you energy, but they do have the vitamins and the minerals and other important nutrients that you need for a heart healthy diet. And what about the complex carbs? These are different from the simple carbs because they're digested more slowly and they have a slower release of glucose into your bloodstream. But they're not all created equal. They can be refined or unrefined, and the refined ones are like white flour, any white bread or white rice, where the nutrient is bleached out of the organic food source, versus the unrefined ones like whole wheat, brown rice, are nutrient dense. So those are the ones that we recommend. So just to understand, knowing what your carbs are, what's good, what's bad, you have to understand what is the component within the food that you eat. And simple carbohydrates, this is just like a list of foods that contain simple carbohydrates with added sugars like candy, honey. Those are the typical ones. Molasses, soda, syrups, sugar, white or brown, white rice, white pasta, and breakfast cereals are some of the high food groups that have high simple carbohydrate and added sugar components. And what about the complex carbohydrates? So fruits, legumes, starchy vegetables like sweet potatoes, and whole grain products, bread, rice, and pasta. And what does the American Heart Association recommends? So obviously you're limiting refined sugars that are, provide you only simple carbohydrates. They have, especially the ones that are added sugar, that are empty calories. You're just getting the calorie without the important nutrition, very low nutrition value, and you're weight gain is the other side effects of these foods. And choosing complex carbohydrates, fruits and vegetables, but you have to be also aware of how much you take in, even if they're healthier source of your simple carbohydrates, there still need to be moderation, and we'll go through portion control and serving size later in the talk. And obviously, sourcing like legumes, beans, lentils not only are great sources of complex carbohydrates, but they also provide protein. And then including whole grains. So if you have to eat pasta, going for whole grain pasta, whole wheat bread, and making sure that your cereals are not very highly processed. So those are simple selections that you can make to make it healthy. What about fats? These are the other major fats are the second major food group. The dietary fats are actually very important for your body function and cellular health. Not all fats are bad. Not all fats are created equal. And these are just like a list of some of the important functions that fats have and why we need to incorporate them within our daily diet. There are 4 types. There's the saturated, trans fats, monosaturated, and polysaturated fats. This may be, most people are aware of saturated and trans fats. Those are the most common ones that we hear a lot. Maybe not so much the unsaturated fats, which there are 2 kinds. this is a very helpful slide, which I think simplifies basically what's to love, what's to limit, and what's to lose. And as you can see in the love it category, these indicates good sources of fats that you can include, including like oils, types of oils that you have to select, which I'll go through on the next slide. But foods like avocado, fish, salmon, those are really good ones. So those are to love, and they're have unsaturated. So unsaturated is good. So they have the poly and the mono unsaturated fats. What's to limit? Obviously, cheese, butter, heavy cream, things like bacon, like meat sources of fats. In moderation, it's not about elimination, but moderation and making sure that you're going for leaner version as opposed to ones that has a high fat content is very important. So for the saturated fats, limiting is very key. And then what's to lose? So these are the ones that are not only empty calorie, very high calorie, but very low nutrition value, like the donuts and the sweets. And so those are the ones that, especially if you have heart disease, you need to eliminate some unhealthy components of your food. This is what to lose, what's recommended to lose. Okay, so good fats, again, just going a little deeper, go fish. If you're going for animal products, eating fish it gives you not only good source of fat, but very high on omega-3s. Nuts are another good source of fat. Avocado, plant-based, and then making sure that you're using oils that are good, which I've listed on here. Corn oil, you have to be careful as far as where it's coming from, but canola, olive oil, peanut, safflower, soybean, sunflower, avocado, grapeseed, which are not included here, but those are all good. And making sure that which of your oils are heat resistant, because sometimes some of them, like olive oil, when it's not meant to be for cooking with like high heat, because it actually turns into potentially a trans fat. So just understanding that is also very helpful on how to utilize it the best for your heart. So moving on to the third category, that's the proteins. The American Heart Association recommends choosing healthy sources of proteins. So mostly from plant sources, that guarantees you to have a healthy source of protein. Obviously, people, it's still possible to have a healthy diet without necessarily going only plant-based, which would be, vegetarian or vegan diet. And there are very healthy sources of meat sources of protein as well. It's just a matter of, going for leaner and also regularly eating fish and seafood, and substituting nut fat and low fat dairy products. Like instead of whole milk, you can go 2%, 1%, or 0% fat. And same thing with your yogurt. And if you're eating meat, poultry is healthier than the beef and pork or the red meats, which have more saturated fat than chicken, fish, turkey, and obviously plant proteins. So eating a lot of meat, and some people who follow a keto diet for various reasons, it could be for weight loss, does not necessarily mean that it's in a healthy way of losing weight. You just have to make sure that where you're getting your protein, and especially if you have high risk cardiovascular disease, you have family history of premature heart disease, red meats may not be the best way for you to get your protein source, a bulk of your protein source. What about salt? Salt is one of the, so many Americans have acquired a taste for a high salt diet because it's in everything. that we eat, especially processed foods. And one way that you can cut back is obviously to not add salt into your diet or skip, table salt. However, most of the food, especially if you're buying packaged food or canned food, you have to be very intentional to look at the food labels and make sure that, understand how much salt is in it, because pretty much everything has salt, including even foods that you get that are fresh vegetables. Salt is a component of many of the foods that we eat. So, which is why even if you avoid adding salt to your food, you still may be taking in more than what's recommended. And obviously, we talk about sodium, especially in our patients who have high blood pressure, heart failure, because it makes you retain fluid, it makes your blood pressure out of control. So it's very integral with, for hypertension diet. But obviously it's the damaging effects of salt goes beyond just uncontrolled high blood pressure or heart failure. And what's before we go there here. So 7 salty myths busted. So myth number 1, eliminate sodium completely for good health. That's a myth. You need some electrolytes within your diet, whether it's coming from your drinks or your food source. You need some amount. It's just, like most things or all things that we do in life, and including with our diet, you need a limit or a moderation. Sea salt has less sodium than table salt. That's also a myth. They're equivalent, about 40% sodium. I usually don't salt my food, so I don't eat too much sodium. Again, this is another myth. A lot of people feel reassured that they don't add, so they don't add salt to their food, so they may not be consuming. But if you are not understanding of what your ingredients are, if you're cooking at home, or even if you're out eating at a restaurant, you may not be adding some more table salt, but if you're not really aware of what they put in it, you can still be consuming more than what's recommended. And this is based on a study. About 71% of sodium Americans consume is estimated to come from processed and restaurant foods, and not the salt shaker. High levels of sodium are only found in food. Some actually, like some over-the-counter medication supplements could have salt. So if you regularly use over-the-counter medications for different reasons or supplements, you have to be aware of, again, what other components are put in them. And lower sodium foods have no taste. Possible, I mean, depend. Each person has have their own palate, but great like spices, herbs, and other salt replacements could be a good way of replacing and making sure that you're still enjoying your food, because that's also important. And then my blood pressure is normal, so I don't need to worry about how much sodium I eat. That is not true. Obviously, as we all age, we tend to our kidneys are not as efficient as getting rid of salt as when we're younger, so we may be more limited as we age, especially. And the daily recommended dose, even if you don't have high blood pressure, so the daily recommended dose is about 2300 milligrams, and it's actually 1500 for most patients with heart failure and hypertension. So we're a little more stringent with with our patients who already have developed some of these risk factors for heart disease. And the last one, I do not eat a lot of salty food, so I don't eat too much sodium. Again, this is another myth. Sodium is found in all foods as just like a part of the component of the food itself or the ingredient. So you just have to be aware of what you're eating and making sure that you're not overdosing on your daily limits, which is very easy to do. And what are the effects of excess levels of sodium? How too much sodium affects your health? This basically shows that 7% comes from processed and restaurant foods, about 11 is added while cooking or eating, and then about 14% occurs naturally. And keeping your sodium is important. These are some of the areas where you can limit your salt intake, and obviously some of the bad effects include enlarged heart muscle. That's a secondary to having high blood pressure, headaches, kidney disease, osteoporosis, stroke, heart failure, high blood pressure, kidney stones, stomach cancer. So these are some of the side effects that you could be experiencing from too much salt intake. And then the last category, as far as like food group, sugars. And this is another one that unfortunately most of American diet has a ton of processed and added sugars that have pretty much zero nutritional value, but are essentially empty calories. And also this is exacerbated by the fact that our portions are much bigger than the average what's used like globally, especially in those that come from drinks. So what's recommended, women and kids, about 6 teaspoons, 25 grams of sugar, about 100 calories or less. And men, about 9 teaspoons, 36 grams and 150 calories or less. And where do we have a lot of the added sugars in our diet? If you like soda, sugary drinks, flavored drinks, sweetened breakfast, syrups and sweets, frozen treats like ice cream, and then sweet baked goods. So these are the ones that have high sugar content, and most of it is added sugar, which has very limited nutritional value. What about these non-nutritive sweeteners, the artificial sweeteners that have become more popular lately because of their low calorie or no calorie content? Again, they have no nutritional value. You have to be aware that you're not replacing them in other aspects of your diet, even if you're controlling your what you put in your coffee or tea. And as far as the FDA is concerned, stevia, truvia or purevia, monk fruit, and allulose are considered generally recognized as safe. So those are alternative sweeteners that you can use in your drinks as opposed to using sugar. And this is, again, just to highlight to you where most of our added sugar comes from. You'll be surprised, 1 can of soda has, which is about 12 ounces, has 150 calories and 10 spoons. So for women, we're recommended 6 teaspoons, and then men 9. So if you drink a can of soda a day, you've already exceeded, and that means anything else that you drink or eat outside of that is additional. So it's just to say it's not that hard to exceed the daily amount. And as far as what are the effects of how does it affect our health? Cardiovascular disease, cognitive problems, dementia, Alzheimer's, cancer, diabetes, high blood pressure, cholesterol, and triglyceride levels. And this is something that I come across a lot with my patients who have high cholesterol. A lot of times, most people think fats only contribute to your cholesterol levels or uncontrolled, cholesterol. It's actually a lot of the processed sugars that we eat, including alcohol, could actually make your cholesterol worse. And in order to improve that, I usually recommend to patients not only cut out fats, but also the amount of sugar, especially simple added sugar that you have in your diet. So obesity, liver disease, pancreatic cancer, and eye problems. So these are just a few. Inflammation, overeating, overeating because you're not getting the nutritional value, so you're not satisfied, so it just makes you crave. Sugar is addictive, it makes you crave and tend to overeat. So you get a lot of calories but not the nutrition. Weight gain, skin aging and wrinkles, so a lot of bad, not ideal health conditions, obviously, with from like simple to more severe, like cancer and cardiovascular disease. One, just to make a quick note about labels, understanding how to read labels is important. It's usually, sometimes they may not necessarily list, and there's just so many different names where, indicating where your sugar, added sugar could be coming from. So high fructose, corn syrup solids, and all of these dextrose. So you have to be aware of understanding this. Actually helps you make, even, with snacks, if you like snacking, and looking at the food labels and understanding how much of it comes from added sugars is important. So just to make a note, a lot of these things are hidden if you don't look closely. What about alcohol? Obviously, there's a lot that has been said about, mostly with wine, and its heart protective qualities. It's still not it's not a cause and effect. It's been associated in patients who have higher or better cardiovascular health. They tend to drink, alcohol seems to be one of the components, but there's also a school of thought whether, people who generally drink wine may also be living a healthier lifestyle in general, including, eating healthy. So it's not an isolation. It might be a multifactorial lifestyle contribution, but in any case, what's recommended by the AHA is in moderation, which is basically 1 for women, 1 drink per day, and 2 for men. So some of the things that we run into for our patients who have high blood pressure, alcohol actually becomes one of the enemies to control their blood pressure. I've definitely seen several of my patients who, when they cut down their alcohol content, we actually can come down on some of their blood pressure medications, even sometimes stop it altogether. So you just have to be aware how you respond to it and how much you're taking in, but in moderation, that's recommended. So portion control is a very important component of heart healthy diet. So it's not only like you're eating healthy, but your portions are controlled, that you're not exceeding the daily amount of calories that's recommended. And that depends on your activity level. Obviously, it's 1,500 to 2,000. But in someone who's an athlete, you may need a little more, and someone who's more sedentary, you may need less. So it all depends on your consumption, how much you consume a day, or how much you burn. So portion control is very, very important. And when you eat out, that's one of the biggest problems, especially within restaurants here in the US, because the portions are really large. So, making sure it's not only eating or sourcing healthy foods that are high nutritional dense foods, but making sure that you're eating the appropriate amount. So this is just like a quick, nice list of, vegetables, 5 servings or 2.5 cups, fruits, about 4 servings, 2 cups, whole grains, 3 to 6 servings, dairy, 3 servings, proteins, 1 to 2 servings. So it just kind of gives you an idea of what's to limit, what's to avoid, what to replace. So quick reminder, that you're eating the right amount of portion to maintain a heart healthy diet. What about eating out? Again, this is another area where, since we don't know, some restaurants I think have gotten better about kind of listing calories and ingredients, but you could still be overeating and not understanding what the nutritional value of your food is. Some ways that you can actually checking, the menu online, making sure that, if they have menus, you see what's out there. You can actually ask the 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 restaurant to if they can give you information about the food that you're eating, especially if you have conditions like heart failure or hypertension and you're on a restricted diet, portion control, if the size is too big, sharing appetizers or sharing plates or eating half and then saving it for later. And then making sure you pay attention to what kind of sauces and toppings and dressings are made, because there could be a lot of calories and processed stuff also put in those and those as well. So what's heart healthy diet? So there's a lot that has been said about the Mediterranean style diet, which we still highly recommend, because I think it kind of gives an idea of if some people, if they ask me like what diet should I follow, the Mediterranean style, instead of kind of going into each and every food category and saying like you should do this, you should do that, the Mediterranean style diet typically is pretty heart healthy, because it has a lot of fruits, vegetables, bread, mostly obviously like whole grain potatoes, sweet potato, beans, nuts, and seeds. Olive oil is the primary source of fat, and dairy products, eggs, fish, and poultry, and low in to moderate amounts. So that's a good diet to follow, and it is still recommended by the AHA. What about other popular diets like keto, paleo, Atkins, interval, zone, Whole30? All of these diets could be healthy, but what you have to keep in mind is not all of them actually are AHA recommended. And you still, someone could be following a vegan diet but eat potatoes all day long, and they're technically vegan, but is that heart healthy? No. So you have to be aware of the components that you're eating, that you're adequately getting your fats, your carbohydrates, and your proteins. So all of these can be made healthy. But as far as I think, if you need one recommendation of what is considered a heart healthy diet, the Mediterranean style diet is the one that we still recommend. So this is just a simple summary of 10 ways to improve your heart health. Food is just one piece of the puzzle. Exercise and balancing your exercise and how much calorie you eat. Physical activity is very important as well. And one thing, one area that's not very much known or understood or included within the cardiovascular prevention, or like not as stressed as much, as actually stress. Stress reduction is very important. It's equivalent to smoking a cigarette. If you have high levels of stress, you have high levels of cortisol, adrenaline running in your body, that increases your risk of developing diabetes, central obesity, high blood pressure, all of these have a ripple effect and causing, potential risk for heart attack and a stroke. So stress reduction is very important as part of, leading a heart healthy lifestyle. So this is just a link of where I got a lot of this information. I think it has a lot more. I just barely scratched the surface, as this is a very important topic that I've been discussing with my patients, and a lot of my patients ask, how should I adjust my diet, or should I do a vegan diet, or should I do a vegetarian diet? So I thought it would be a very important topic to review. And you can go to this website, which is the American Heart Association Diet and Lifestyle Recommendation website, if you need additional information or you want to go in depth about some of the topics that we talked today. And I think that concludes my presentation, and thank you for the opportunity, and I'm open for questions.
Fantastic. Thank you, Doctor. This is Brett. I'll start with a few in the chat, and then we'll open up. I've got a few questions here. The first one is I am reading that cholesterol is not the primary problem leading to cardiac disease, but rather it is inflammation. What are your thoughts?
So I think it's, that's very good question. We don't see, when I'm, thinking about, or when I talk to my patients about prevention, I don't see things or in isolation. I don't necessarily say, cholesterol is the problem or inflammation is the problem. Obviously, inflammation is bad, and high cholesterol could lead to plaque formation in your blood vessel, and that's an inflammatory process. And if you have a calcium buildup and you have high cholesterol circulating within your body, that cholesterol gets deposited within that plaque, and obviously that plaque breaks off, and that's what gives you a heart attack or a stroke. So having high cholesterol is sort of like a component of what we care about, which is plaque formation, which is an inflammatory process. So I don't know if I answered the question, like if I answered the question, or like what you wanted to get out of, like in terms of cholesterol. So, okay, let me take a step back. So I don't want you to, fixate on necessarily on the cholesterol. It's one important component that we have to control, but there are also a whole host of other inflammatory processes that we have to pay attention to. Does that make sense? I'm happy to do a follow-up if that did not make sense.
I think for now that's good, and then we can always do a follow-up later. I'll read you the next because we have quite a few questions here. So another one is, most of us Americans aren't very familiar with the volume of grams and milligrams. Could you give an example of those amounts that you talked about?
Oh, that's a very good
question. It's a tough one.
That's a tough one. I mean, yes, the metric system is not as friendly because we don't use it as much, but that's, I think, like one, as far as this might be a good reference actually here. So we're at so 20, where is it? Okay, so men, so these are teaspoons, so about 6 teaspoons for men. So that's like the 23, what was hold on, like the sugar one. That's the one that, was it the salt one? Oh, I was trying to figure out. So 20, that doesn't actually give a correlate. I think, this probably can be looked up online. Like if you can take a look, like what 1 teaspoon of salt typically weighs, and I can look it up and include it within, if there's like something that gets sent out, that's something that could be. But like you can measure by using like a teaspoon or a tablespoon, and sort of understand the correlate, like what that is in ounce or grams or milligrams, and then use that as a guide. Sorry, I don't have a good example off the top of my head.
Okay, let's move on to the next, which is easier. So what causes some people to have high and low blood pressure swings, and how is this treated? Related, what causes fairly sudden drops in BP, say from 90 over 60?
That's a very good question. Okay, so there are reasons why someone may have swinging, high blood pressure and then low blood pressure. Obviously, there are some people where like their system is actually sensitive to changes within their body. What I mean by that is stress level. If anything that kind of causes adrenaline. So what I tell people whenever I'm counseling them about high blood pressure is, it's usually too much salt, too much water, and too much sympathetic drive. So these are the sort of like the big categories that drive your blood pressure up. So if someone has too much salt, and some people may be more salt sensitive than others, so that could spike your blood pressure pretty high. And wherever salt goes, water follows. So if you tend to eat a lot of salt in your diet, you also will feel more thirsty. And when you drink water, that water is used to dilute that salt. So you retain the water within your body, then like flushing it out. So that causes, again, a spike in your blood pressure. And the too much sympathetic drive is anything like stress level, anything that increases adrenaline. Again, some people may be sensitive to that, and that could cause a spike in blood pressure. Aside from that, if you have autonomic dysfunction, whenever we stand, there's an autonomic nervous system that allows blood to that's pulled down in our legs to come up to the center and to the brain. And if you have, for different reasons, you have autonomic dysregulation, and we tend to see this in our diabetic patients who have neuropathy and some neurological effects from the high blood glucose in their blood. That could also potentially cause you to have a sudden drop in your blood pressure, especially in a standing position. So these are, like, to name a few of what could potentially cause some people to be going from high to low, to low. So
Great, thank you. Another one, it says, so many of these recommended food drink items are known to individuals, but we tend to not always follow them. I'm not saying this is good or bad, but it does seem to work. Any comments in regards to, let's see here, I have always eaten and have lost 27 pounds without being on a diet per se. So I guess it's really, the question is, what is your overall thinking from a professional standpoint in regards to many of these diets? People do them on a short-term basis, long-term, but are they really truly the way for someone to be thinking about their heart health?
So what I usually recommend to patients, or when I discuss about lifestyle, what I call lifestyle changes, not just in terms of diet. It's a long-term game. It's a marathon, not a sprint. It is something that you should be thinking about over a span of your lifetime. And a lot of these diets, especially, some of the fat diets, they are only sustainable for a shorter amount of time, especially if you're drastically changing your what you typically eat. So what I generally recommend to patients, you have to enjoy your food. That's the only way that we can guarantee you to sustain it over a longer period of time. And small incremental changes. Obviously, we all have different makeup, some, metabolism rate, depending on your other aspects of life, your daily activities. So we may all be different, be responding to some of these diet changes differently. But what I generally recommend is small incremental changes over time of what is sustainable to you and what works for you, guarantees results. And obviously, weight loss is not necessarily the marker that I typically use, whether someone is heart healthy or not. There are some people who maybe their BMIs may be, over the recommended, which is like 25, but their composition may be different. Body composition, they may have more muscle mass than like someone who has a BMI of 21 and drinks soda all day long and eats potatoes and fries and processed food. So I don't think weight loss necessarily needs to be the end all be all. I think that's what's been the most associated with dieting and food. I consider, because there are some marathon runners who have heart disease and because of their genetics, and there are some who may not be marathon runners and are sort of, so to speak, healthier from a heart standpoint. But so I don't know if I answered the question right. I do definitely agree with the statement of like what works for the patient or individual is important to guarantee a longer sustainability, but weight loss is not the only marker. So I still recommend eating healthy and following some of the recommendations, here. That's feasible. Okay.
Great, thank you. Do you also recommend, before a person were to look at this, they should have a conversation with if they're already under cardiovascular care, they should have a conversation there, or a primary care or a dietitian. They should have some other maybe resource as opposed to Dr. Google online.
100% recommend that, because again, some of these recommendations, I definitely, take into account the patient's some of the data, like their cholesterol level, their family history, if they've already had a heart attack or not, And so a lot of these go into the recommendation as well. This is just like a very overview. And like the person who asked the last question, each person is different. It's not so you to get that personal aspect incorporated, I highly recommend you should definitely talk to your primary care physician or whoever is your care provider, a dietitian, because again, like I said, it's a long-term game, and getting it right, being on a good foot will guarantee a success on the longer term.
Great, thank you. Another question, there's a couple different parts of this, but overall, I think the general question is, do you think there's a benefit, especially from a female standpoint, is there a benefit of seeing a female cardiologist when providing care to your female population? Said, are there specific or different risk factors for women? So do you sense from a female perspective the pros and cons, or not even so much pros and cons, but the access
like
to care?
Benefit or what
Yeah.
could yes, so for females, estrogen has protective value. So typically what we call the high risk zone for men for heart attack and stroke is between the age of 55 and 65, and for women 65 and above. And that's because of the 10-year difference between men and women, or male female, is estrogen, which has some protective value. But as with menopause, we have a bit of a delay start, but we catch up quickly. And as far as I think seeing a female cardiologist, at least, coding some of my female patients, they do appreciate cardiology is not a very diverse, so we're still working on that. There aren't that many females within the field of cardiology, and a lot of my female patients have said that they appreciate seeing a female doctor, getting that extra perspective and relatability, so to speak. And there is a whole field of women cardiovascular health that's currently being, I think, rightfully so, that's been growing over the past decade or so, and that's one of the areas that I'm interested in. So I think bringing that perspective is also important. And the other thing that I want to say, which is very important as far as gender difference, is females also tend to not have the typical symptoms, especially for heart attack, compared to our male patients. The classic heart attack symptom is, an elephant sitting on your chest with pain radiation to your jaw or down your left arm. And a lot of women I have seen who present with a heart attack symptom have a lot more non-specific symptoms. And unless a doctor does a due diligence in terms of really teasing out some of that story, I've seen it being missed in women a lot more than men. So that's also another, I think, important gender difference that needs attention from healthcare providers here.
Great, thank you very much for that. Let's do that was the last question for the most part. Let's open it up if there's anyone who has, in the last couple of minutes, a live question you would like to ask of the physician. Please unmute and ask your question. Bill, did I see you unmute? Are you?
Yes.
Go ahead. If you have a question.
Doctor, nice to have you on the dais today. Very nice to have you here, and welcome to the desert too. One of the things that cardiac rehab is teaching now is the Pritikin diet, and that's the way they got a special thing going on there over at cardiac rehab. So what's your thoughts about the Pritikin diet?
That's a very good question. And that's something, actually, that's not something that I've worked with patients or like recommended to patients. I'm going to have to talk to the cardiac. Is that this cardiac rehabilitation?
Yes. Yes, that's correct. I saw Melissa earlier on this thing. She's the head of cardiac rehab over there. If Melissa is still there, maybe she could say something. I don't know.
Yeah, if I'm happy to give up the floor. But that's a very good question. I can, definitely, I'm still kind of getting my way around, like getting to my way around here, and I'll be happy to talk to the cardiac rehab group and see what they're recommending. I was not familiar that they were recommending a specific diet.
Thank you very much. I also have a follow-up is an invitation. And I represent the Mended Hearts here of the Coachella Valley. And we would love to have you come and talk to us sometime at one of our lectures that we're in partnership with the hospital to do, and talk about this whole issue relative to the women and how different they are relative to heart disease. We know they're different anyway, but you know how that works. But nevertheless, the business of the heart disease, the whole subject of that is quite interesting. It would be lovely to have you come and talk about that sometime, maybe next year.
I'll be happy to.
Thank you.
All right. Other questions from anyone? All right. Last call. Any last comments or words from you, Doctor, or Scott, if you're still on?
I think this is a very important topic, and people have more questions or any follow-up areas of topic that would be of use. I'm happy to do a follow-up to the lecture, but yeah, that's all. And thanks for the invitation.
Absolutely. Well, we definitely will be reaching out to you to do another lecture. So no worries there. Well, all right, everyone. Well, as I said, this has been recorded and it will be edited, and then we will get it online and blasted out. If you registered through Eisenhower's website, then I will automatically send that link to you as soon as I have the video in hand, and Dr. L will also send it to you along for yourself. All right, with that in mind, thank you again for your time over lunch, and have the rest of a good week, everyone. Thank you so much.
Thank you.